Hi, it's Dr. Teresa Cullen. It's July 15th, Pima County Health Update. We're going to talk about data today. This is Wednesday, and that's our day today. First off, I want to talk to you about our cases. And as you can see on this chart, our cases continue to increase. What's important to recall is that we had a very long period of time, actually 11 to 12 weeks, where we had cases that were around 200 to 250. Right now, we're still at a peak. And I want to remind you that what you see for week 27 and 28, those numbers are still being collected. So when you look at this chart, you'll see the peak number of cases we've had so far is 2,300 in a week, 10 times what we had early in that pandemic. Important to note that we still have what we call accelerated transmission in the community. Next, I want to share with you the death data. Now, you will recall early on in the pandemic, we had an accelerated period of death. Most of that was due to our long-term care centers. However, as you can see right now, our death rate seems to be going back up. Week 27 indicates a high rate. Remember, death data lags by up to 4 to 6 weeks, so we expect that these numbers will increase. The reason why I'm sharing the death data with you is to remind you of the potential severity of this disease. People do die from COVID-19. The vast majority of people end up not hospitalized, a small percentage hospitalized and do fine, but a very, very small percentage end up with death. And we want to remind you of that so that you will follow the recommendations that we have given you in the past. One of those recommendations is that to seek testing if you're symptomatic or you've been exposed to someone with COVID-19. You can click on the URL that's in this, and it will take you to the Keno Events Testing Center that the county has stood up and is supporting. I'll recall for you, this is for people that are symptomatic or have been exposed, and the testing is free. This is Dr. Cullen bringing you your Pima County Health Update, July 15th.